Hi everyone, my name is Dr. Surakshith Battina. I'm an endoscopic surgeon, a fertility expert, and a cosmetic gynecologist. We need to talk about today is urinary frequency and also increased dribbling of urine every time there is an increased amount of intra-abdominal pressure, like if you sneeze or cough, if there's dribbling of urine. These are things we need to take into consideration because, of course, we know that women today are living for longer than how they used to in the 1940s or 1950s, and a lot of women are actually living for much longer in the menopausal period. So I think this is a very important topic going forward. On an average, somebody goes to the washroom around 6 to 8 times, and this again, I think we should not really consider this as something called as frequency, because even sometimes it's going to be 10 to 12 as well. It's absolutely okay as long as it does not decrease your quality of life. The moment you realize that this urinary frequency, or whenever you cough or sneeze, you're having this dribbling of urine, it is affecting your quality of life. You're not able to go and spend time with your friends, or you're not able to go to the gym because of this. Those are the reasons when you have to start seeking treatment. I think this again depends on how you have trained your bladder. So most of these women, we ask them to have something called as a bladder diary, where there are intervals of every 2 to 3 hours. We ask the woman to go and void, urine, and I would say anywhere between 2 to 3 hours, 6 times a day is quite is normal. There are two main reasons why there might be increased frequency in women. The first important thing is that there might be some neurological anxiety related issues which have to be sorted out. And of course, there might be loosening of the pelvic floor muscles. And this is the second reason why women will have urinary frequency. Or if in case the woman was having a very difficult delivery, like she had a forceps delivery or some trauma during her childbirthing period, they might have this urinary frequency and urinary leakage. And sometimes even women who have never given birth, young girls around 18 to 20 years, because of some genetic issue, they can also have this urinary frequency and leakage. I think this is a multidisciplinary approach. You need to have a gynecologist with a psychologist as well as a psychiatrist and a neurologist on board, because as I said, any treatment is always multimodal. It was previously said that if one doctor is not able to solve your issue, then no doctor will be able to solve your issue. That's not the case anymore. I think we need to start looking at this in such a way that it has to be a multimodal treatment. At the end of the day, they should be able to improve their quality of life, because I've seen a lot of women who just think this is the normal way of life because their gynecologist has said, this is the way it is going to be. You have to live with that. They completely stop seeking treatment completely, and that is not the way. Go for a second opinion. Make sure that you understand where the problem is. And yes, of course, all of these are solvable. The moment you realize that there is a treatment, please go and seek it. Do not live with this because it's not required.